Ang pagbaba ng mga kaso ng COVID-19 sa bansa ayon sa Okta Research, maituturing na low risk for COVID-19 na ang National Capital Region. Pero kumustahin natin ang estado ng bansa laban sa kontra COVID-19? Makakausap po natin si Dr. Rajendra Yadav, Acting World Health Organization Philippines Representative. Good morning, Doc Yadav.
Good morning.
Doc, after experiencing Omicron surge last month, COVID cases start to decrease and are expected to continue to drop by 1,000 per day by the end of February. Can we say that the worst is over for the Philippines?
Yes, the decreasing trend of the number of new cases is really very encouraging. We also have seen a relatively low number of deaths during the recent Omicron surge. And also the nationally healthcare utilization rates are quite stable. So for now, we can say the worst is over, but that's only for now because we do not know how long this current favorable situation will last. We need to hope for the best, but remain prepared for the worst.
Yes, Dr. Yadav, the government considers crafting or shifting to its pandemic exit plan. Part of being considered is lifting the alert level system. Is the Philippines ready for this, or is it too early to shift for the pandemic exit plan? Related question from our reporters from PTV Les Moras. Do you have any inputs on what policies must they include? When do you see the perfect time for the Philippines to shift to the new normal?
So every country has a unique situation and must chart its way out of the acute phase of the pandemic with a careful stepwise approach. So it's very difficult to say and not easy to have answers for all countries. But yes, WHO continues to support the government in all its efforts. As long as we take care of the three things that we know work best, then opening up borders and relaxing the quarantine protocols are fine. One of them is ensuring that we have vaccines, oxygen and antivirals for people, especially for the people who need them. Secondly, we have to continue to implement public health and social measures like maintaining physical distance, wearing well-fitting masks, avoiding poorly ventilated spaces, cleaning hands, following respiratory hygiene. And thirdly, if we need, we have to restore and sustain the essential health services which have been disrupted by COVID-19. So if we do these three things, then yes, we are on our way to living with this virus.
Yes, another question from Les Moras for Metro Manila, which is now at low risk for COVID-19. Do you think it is about time to place the region under the most lenient alert level 1?
So WHO has always advocated for a risk-based approach. We have to balance public health measures on one side and socio-economic measures on one side. So as long as we can do de-risking of travel within Metro Manila or anywhere even outside Metro Manila, having this balanced approach is welcomed by WHO.
Yes, Dr. Yadav, yesterday the Philippines started to accept fully vaccinated foreign leisure travelers from visa-free countries. The government also lifted quarantine guidelines for inbound travels. Question from MJ Blanca Flor of Daily Tribune: is the Philippines on the right track in terms of reopening its borders for fully vaccinated tourists, considering that the country has reported below 5,000 new cases in recent days? Does the WHO think that the measures imposed are enough to prevent a possible spread of COVID infections?
So we encourage de-risking travel, which means that we have to take necessary steps to reduce the risk of COVID-19 infection during the travel and after the travel. Blanket travel bans can give a false sense of security and destroy economies. However, we must be cautious about interpreting these easy travel restrictions and quarantine requirements. Easing travel restrictions and quarantine requirements does not mean that anyone can travel anytime, anywhere they want. We need to follow the minimum public health standards like masking and physical distancing while traveling, travel only when necessary, and keep our safety bubbles as small as possible. If that is taken care of, then yes, relaxing the travel requirements and quarantine requirements are a go.
But aside from that, Dr. Yadav, what should the government do to avoid another surge amid loosening of travel restrictions?
So we need to continue to do what we know works best in this situation, have very high coverage for vaccines, especially in the people who are elderly, because they are more likely to develop severe COVID and die. Also, when people travel, we have to ensure that they are maintaining the minimum public health and social measures. And that's what we are doing, and we are supporting the government to do.
Dr. Yadav, the country started vaccinating children from 5 to 11 years old. Meanwhile, the third round of the two-day nationwide vaccination drive also started yesterday. Dr. Yadav, is the government doing well in terms of vaccination? Is there a need to focus on areas with low vaccination turnout?
So we congratulate the Philippine government for vaccinating over 60 million people so far. That is 70% of the eligible population over 12 years old. So that is really good. However, we also know that over 2.5 million senior citizens remain unvaccinated. They have not even received a single dose. So vaccinating older people is one of the most impactful ways to save lives during this pandemic. We know that senior citizens are at high risk of developing severe disease, getting hospitalized and dying from COVID-19. With fewer restrictions and higher mobility happening now, we could be putting our unvaccinated senior citizens at risk of hospitalization and death. We appeal to the governors and mayors to do everything in their power to vaccinate our priority groups as soon as possible. We need to vaccinate the high priority groups before another variant causes another surge. Many provinces have very high number of senior citizens without a single dose of 19 vaccines. Some of them are like Cebu, Negros Occidental, Batangas, Cavite, Bulacan. So I appeal to these places, the authorities of these places, especially the governors and mayors, to vaccinate the elderly, and then we can already be starting moving into the direction of living with the COVID and as an endemic form.
Yes, a question from our friends from the media. Evelyn Quiroz of Filipino Mirror. The drive to vaccinate children aged 5 to 11 against COVID-19 started last Monday after initial problems over delayed deliveries of the Pfizer biotech doses and opposition to the drive by some parents. Has the WHO encountered the so-called opposition from parents in other regions of the ASEAN?
So WHO encourages children to be vaccinated. These vaccines are very safe. We should not create unnecessarily panic among parents by spreading misinformation. We have not seen that these vaccines are causing any more side effects than other vaccines. These are very safe vaccines and effective. If we don't vaccinate our children, they are also likely to develop severe COVID and die. Especially if they have comorbidities. So I encourage all parents to go out and get vaccinated for their children.
Yes, question from Red Mendoza of Manila Times. What is your reaction to the increased opposition of some parents, which is being fueled by some anti-vaccination groups to COVID-19 vaccination because they are comparing it with the issue that surrounded the dengue vaccine nearly 4 years ago?
So these vaccines have been used in many countries, including in younger age groups. WHO has approved them. So we continue to recommend that this vaccine should be used in children too. And I would appeal to the people who may be spreading misinformation to not do that, because then we'll be putting our children's lives at stake.
Dr. Yuda, based on the monitoring of WHO, what are the chances that there will be more transmissible COVID variants? What is the future of COVID variant? And what can you say about the statement saying that Omicron might be the end game for the pandemic?
So we have a lot of uncertainties about the future evolution of this pandemic. It is very dangerous to assume that Omicron will be the last variant or that we are in the end game. New variants could emerge. And these new variants could even evade our countermeasures, may even become fully resistant to the current vaccines, which will necessitate vaccine adaptations. So although vaccine supplies have risen significantly everywhere, the African continent continues to struggle with vaccination rollout. As you may know, only 11% of the African population have completed full vaccination, which means less vaccination means more transmission there, and more transmission means we have high chances of new variants emerging there. But then this can cross over to any country. What happens in other countries affects the Philippines too, because we cannot virus-proof our international borders. So if other countries have low vaccination coverage and high transmission of the virus, yes, we expect that we could have new variants in the coming weeks or months. Let's hope that that doesn't happen, but let's be prepared for the worst.
Dr. Yadav, as the acting WHO representative, Philippine representative, what are your next steps or plans in the coming months regarding the Philippine COVID response? Do you have other areas or programs that you would like to focus on?
At WHO, we will continue to provide relevant evidence, strategies, and technical and operational support to the government, of course, as we have been doing in the past few months. But at the same time, we know that many other essential services have been disrupted significantly. In fact, every service we know are affected by this: sexual health, reproductive health, maternal newborn, child health, nutrition, cancer, tuberculosis. So all these programs have been affected. And that's why WHO continues to support the government to scale up the COVID-19 vaccine and other measures on one hand, but also support all the bounce back of the other programs that have been disrupted.
Dr. Yadav, may we get your parting message for Filipinos as we continue to face this pandemic?
My parting message is that we can end the acute phase of the pandemic within this year. We can end COVID-19 as a global health emergency, and we can do that this year, yes. But we have to come together as a nationwide and worldwide community. Most importantly, we have to ensure that our vulnerable populations are fully vaccinated as a priority, because no one is safe until everyone is safe.
Thank you very much for your time. Acting World Health Organization Philippines Representative Dr. Rajendra Yadav. Stay safe, Doc.
Thank you.